All right, in this lecture, we're going to just talk about kind of the basics of E-stim for pain control. And so in particular, I'm going to describe ways in which E-stim is used to modulate pain and just talk about the general parameters and the settings and the types of currents that we're going to be dealing with E-stim for pain control. In a separate lecture, we'll talk about how we think that this really works. We'll touch on a little bit as we go along in this lecture. All right, so we have three basic treatment methods when using E-stim for pain control. The first is subsensory, second is sensory, and the third is motor level stim. The first being subsensory stimulation, you'll see that on your machines called microcurrent. And so if we look at our diagram of sensory, motor, and then the N, we'll call that noxious level. We're going to talk about that here in just a little bit. But where we're talking about is the area before you hit the sensory nerve right here. Okay, so anywhere along in here, in this area right here. So before we've really depolarized anything, that can be felt. Okay, so that's called microcurrent, subliminal stimulation, and the intensities are just well below the threshold for nerve depolarization. The bottom line in the red letters at the bottom of the slide here, known efficacy. Study after study has failed to show any effect greater than placebo, but you will run into people that use it and use it consistently and claim that there's an effect, but no one's been able to show that in any kind of controlled study. Okay, so most common then would be sensory level TENS, and this is what you would call conventional or high rate TENS. And we talked the other day just about the word TENS, and that it's a bad term because we typically, it's the generally accepted term for pain, E-stim for pain relief, but it just means transcutaneous electrical nerve stimulation, and that's what we do with everything, whether we're stimulating muscle or contracting muscle, we're stimulating the nerve, we're going through the skin, so that's also transcutaneous, right? So that's why the terminology is bad. Not going to go away anytime soon, so we just have to deal with it. So, typically when someone says set up a TENS treatment, this is the one that they're going to be talking about right here. All right, so also known as conventional high rate TENS, and the parameters of that are usually in the 50 to 100 hertz, usually more towards the high end. You'll see the machines coming to life more along that line of the 100 hertz or pulses per second, but with a very low duration. So again, looking at our pulse duration curve right here, we're going to be out in this area or down in this area in this 20 to 100 range right here. And so we're going to use that so we preferentially just get our sensory nerve fibers stimulated. Kind of the short version then of how this is supposed to work is, as it says here on the slide, a direct block of transmission. So basically, putting the nerve on a busy signal. We're putting some stimulus into those large diameter nerve fibers, and we're kind of tying up the transmission of those the painful responses that are traveling up those same nerve pathways. And so since we're just putting this on a busy signal, once we take it off, we don't have any more pain relief. So it has a quick onset. That's what we hope, is that it's when we put it on, we basically put it on busy signal there. And but the problem is as soon as you turn it off, typically the pain relief is going to end. All right, so the indications for it then are when we want to have pain relief, when we have stimulation. So good ways to use any kind of pain relief stimulation is maybe during your exercise. So you've got someone that comes in is having trouble doing their low back exercises, so maybe you do this treatment while they're exercising. So they're able to go through normal ranges of motion and exercise while you're working with them. Okay, so the general parameters as listed there, usually at that high rate, like I said, usually towards the higher end of that, in the 100 hertz or so pulses per second for the frequency. Low duration in that 2 to 50, and that's probably usually closer to that 50, maybe 40 to 50 microseconds. And then a lower intensity, and we're just going to set this based on the patient tolerance, and you're just going to take it up to where you get a tolerated tingling. So you turn it up, do you feel that, and then take it up to where they have a very more or less pleasant tingling sensation. All right, so that's setting up high rate or conventional TENS. All right, the first of the E-stim for pain currents that we're going to talk about is what would be called sensory level TENS. A lot of different names for this, from conventional TENS to high rate TENS. But typically we're using the machines that you buy, the little TENS boxes that you buy, typically have an asymmetric biphasic current in them. But it can be just any type of current that you can set the settings, like we're going to see here below. And the settings more or less apply to interferential as well. And as we start to look at this, and then we'll talk later about interferential in particular, but you'll see that it's kind of similar. So we're going to look for that low pulse duration, like we saw on the pulse duration curves. We're going to be down in the range that we want to preferentially get our sensory nerve fibers. And you'll see most of these boxes are in the 50 to 80 microsecond range, but basically less than 100 microsecond. Frequency is going to be towards what would be called the high rate range, is in that 100 to 150 hertz or pulses per second. Just remember those two words are interchangeable. And we're going to turn that up to a tolerated tingling. And just, you're going to ask your patients, do you feel this? And then take it up to a comfortable level of stimulation. There's no ramp, because really we're ramping this as we turn it up. So, you're slowly turning it up. And then it's just going to run continuously. The treatment time can be worn as needed. So it can be worn continuously, worn for 24 hours. It can be turned on and off, basically, as your patient needs it. And then electrode placement, just extremely variable here. And so you can usually start with, over and around the painful area, but you can also use any related area. So you can look at a trigger point map, a acupuncture map. You can find trigger points and work on trigger points. You can work dermatomally and place them at a distance, even away from the painful area, just over the dermatomal map. For instance, you can, for someone with radicular pain down through C8T1, you could take the pads and put them at about the C8T1 vertebral level and possibly get some effect right there as well. And so moving on then, looking at the next way to apply E-stim for pain relief, we're going to talk about what's called motor level TENS, or low rate TENS, or acupuncture like TENS. Lots of different names for all these different things. But basically what we're talking about here is a very low rate, less than 10 pulses per second. Again, pulses per second or hertz. The low rate, but we're stimulating muscle at this point. So we're getting a muscular contraction, and but at a very relatively low rate, 10 pulses per second. And so the mechanism for this, the main theory is that this is opiate mediated. And so as you can imagine, if we're doing something with an opiate, that we're going to get a little longer lasting effect. So this one is typically used after you do the treatment, that you can tell your patient that what you hope for is that you're going to get some pain relief over the next 45 minutes, basically like taking medication. It's not going to come on immediately, but we hope that it's going to last for a few hours after you've applied it. And so basically you're going to use it when you want pain relief after the stimulation. So if you want to block something immediately, you're going to want to use your high rate TENS. If you want a little longer lasting, sort of after the treatment, then motor level TENS is going to be a better bet. So the settings for this, again, any kind of stimulus that you can use to contract muscle. So you're going to be in that 100 to 600 pulse duration range. Again, more commonly in the middle of that range, 200 to 300 or so. And you're going to turn this up until you get a nice contraction. So kind of a tolerated contraction. It doesn't have to be, you don't want it to be painful, but you're just going to get a nice twitch of the muscle going. It should definitely be visible and tolerated by the patient. That's why I just called it visible and tolerated contraction. Again, no ramp, because you're ramping this yourself as you're turning it up. You're just starting the machine, turning it up till you get that nice contraction. Hit the start button. The start button just starts your countdown timer, and it'll run. Treatment time for this can be 20 to 30 minutes, sometimes shorter as well. There's no on-off. This is just going to run continuously. Again, your pulse frequency is going to be somewhere less than 10 pulses per second, and electrodes, again, here you're going to go over the area that's related to the pain, where you're finding the problem. Okay, another way to apply this is using what's called Noxious level stimulation. This used to be marketed as a machine called a neuroprobe, and we have one here in the lab, and we'll pull that out and play with it a little bit. But this is most commonly used when someone has chronic pain and where the other types of E-stim have failed. But this is another area that's commonly neglected. Most people won't know how to do this, but it can be very effective with your dancers and just your overuse sorts of people, like musicians, that are constantly having to use their extremities, and maybe have a really bad epicondylitis or something, but they're practicing 8 or 10 hours a day, and that's how they're making their living, and so they're working right through their pain level. So someone like that's got that chronic sort of pain, this has been shown to be pretty effective, and it's a pretty short treatment, and again, giving you long-lasting pain relief. Looking at our pulse duration curve, we're out where on this diagram it's showing it as an N for Noxious level stim, and so we're getting out where we're hitting some of those pain fibers. And so the type of current that you want to use for this, you can use a lot of different types of current, but I'm just going to put it on here as using Russian current. We'll look at a short little article that I ran across recently by a researcher from over Delaware that I heard last year at CSM, and this was the recommendation here. This is, I guess, one of the ways it was first described, and that was using Russian current. So of course we're back to our 2500 hertz, 50 bursts per second, and it was initially described with an on-off time of 12 seconds on with 8 seconds of rest, using some pretty small electrodes directly over the site of the pain. And the amplitude, you're going to take this to a max tolerable tingling. So I didn't put that word in there, but max tolerated tingling. We're not going to try and drive this to a contraction. So you've got to watch this one, because it's going to really want to try and contract the muscles. So you're just going to take this up to a max tolerated tingling, and put a reference in down there below from a JOSPT. And precautions or contraindications, really the same for any other E-stim device, as we discussed. For pacemakers, often it's suggested that an ECG is done during a TENS trial to make sure there are no adverse effects. So one of the things to look at is just who's doing the referral for the TENS unit. When you've got a patient that does have a pacemaker. Typically these days pacemakers aren't affected by TENS units, but always a good question to ask. And so good to call the physician or ask the patient, was this is this being recommended by your cardiologist, and has he seen his cardiologist recently? Does he know he's getting a TENS unit? And so do some trial and checking like that prior to giving just handing one to someone who does have a pacemaker. Okay, the FDA suggests that E-stim shouldn't be used over the abdomen of pregnant women, but you'll see a lot of recommendations for people using TENS units during labor and with no complications noted. All right, so and again, the most common complication with these kind of units, skin irritation due to electrodes. All right, so you just have to watch, and current intensities, they can cause burns, but as well just someone having a reaction to the stickiness in the pads too. So some people can have problems with the pads. All right, so that basically covers the major types of stim that we're going to be using for pain relief. We didn't talk in particular about interferential, and so we'll talk about that in another lecture as well. But interferential would be the other current that we're going to be using for pain relief. And after you look at these parameters, and then we start to talk about interferential, you kind of get the idea of why interferential works, very very similarly. And we'll look at that in lab this week. All right, I'll see you guys in lab. Bye.